Welcome to Cardiovascular Matters. Whether you are looking for answers for yourself or someone you love, we are here to give you the best information available. Each week, the founder of Cardiovascular Institute of the South, Dr. Craig Walker, and medical device sales veteran Terry Roberts discuss the causes, symptoms, treatment, and prevention of health-related issues stemming from cardiovascular disease. Now here's your hosts, Dr. Craig Walker and Terry Roberts.
Hello, everyone, and welcome back to Cardiovascular Matters. We've had a number of episodes talking about the new emerging drug category we'll call GLP-1s and the wonderful benefits they provide in terms of use with diabetic patients and also more recently with weight loss. But there's a new category or a new treatment they've been recently approved for, and that's sleep apnea. And today, Dr. Walker is going to be discussing the issues with sleep apnea and how this drug or I guess hormone category may come into play to help treat some patients. Dr. Walker?
Thank you, Terry. Yes, sleep apnea is a huge problem in the United States. And really, sleep apnea comes in two forms. One form is what we call central sleep apnea, where the brain simply does not send enough signals to our diaphragm to breathe effectively. And there have been great strides in the treatment of that, where we can implant pacemakers to actually pace the diaphragm to make sure that one breathes normally. But the more common form of sleep apnea, usually seen in obese people, but not only in obese people,
Right.
is obstructive sleep apnea. Now, the hallmark of obstructive sleep apnea is snoring. And the reason one snores and the reason that this is a problem is the back of the tongue and all of that apparatus, typically at night when we're sleeping, falls back and it starts to cover our windpipe. Now, that achieves basically the same effect as if someone were to put their hand over your nose and mouth and stop you from breathing. But obviously, the body does not like that. And what happens with obstructive sleep apnea, there are many huge problems, dangerous problems associated with it. Number one, it is strongly associated as a causal factor in atrial fibrillation. And we all know atrial fibrillation carries risk. You can, atrial fibrillation can cause very, very fast heart rates, which in and of themselves can be dangerous. It can result in clots forming in the atrium because the heart is just quivering at that point. The upper chambers are quivering. Clots can form in the appendage of the atrium. And actually, these can go wherever we have blood flow. And since a disproportionate amount of our blood flow goes to the brain, it can result in stroke. It can also go to other parts of our body, however. It can go to the legs. It can block our kidney arteries. It can block gut vessels. So atrial fibrillation is a huge problem. A second problem associated with sleep apnea is congestive heart failure. Third problem is hypertension, very poorly controlled hypertension. And one of the other hallmarks, along with people simply snoring, is chronic fatigue. In fact, many believe that the most common cause of chronic fatigue is sleep apnea. Now, we know that sleep apnea is far more common in obese than non-obese people. And in today's world, it's a really easy diagnosis to make. In the past, people used to have to go into centers and try to sleep, and it was unfamiliar territory. There were other people in there. Beds weren't necessarily comfortable, and it was somewhat obtrusive, not so easy to do. Now we can actually get a better study, and it's easier by wearing a watch-like device that you just put on your wrist, and it syncs into one's smartphone. And we can detect both central and obstructive sleep apnea with this. So making the diagnosis has become much easier. Now, traditionally, when we speak of obstructive sleep apnea, the treatment of choice was CPAP. Now, CPAP is when we put a mask on, and this mask applies positive end pressure. So normally we breathe out, there's no pressure left in the lung. Well, this applies a pressure. And the idea is that this can help keep the windpipe open rather than the windpipe falling. And many people have had tremendous relief with this and tell me they wouldn't go anywhere without their CPAP. However, there are many people who can't tolerate it. Many people simply find the CPAP gets in the way. There are tubes attached to it. And if they have to get up for the bathroom in the middle of the night, they claim that it's a problem. And so we've always looked for other options. Well, another option that's come out that works, but it's not covered typically by insurance, are retainers placed in the mouth that hold the tongue in place at night. These work. They can cost anywhere from $1,000 to $3,000 is what I've seen in the past, but they do work fairly well, and many people have gone to that. But perhaps I think the thing that I've found most interesting recently is the recent approval of tirzepatide by the FDA for sleep apnea. Now, the GLP-1 agonists are diabetic medicines, and they have many aspects of how they work. But one of the things that's associated and strongly associated with these agents is weight loss. And since we know that increased weight seems to be causal and strongly associated with sleep apnea, this can really be transformative. And this can do more than just treat the sleep apnea, because in treating obesity, which I must tell you is a disease, it's not just a symptom or a sign, it is a disease. It affects so many other things: our blood pressure, likelihood of heart failure, our blood glucose control, you name it. All of those things are affected by obesity, even orthopedic problems. And so now that tirzepatide has gained approval, and I don't know, but I suspect other GLP-1s may get that same indication because they certainly are associated with weight loss, but I don't know. I guess it could just be one that does this. We have a study for that at this time, but we'll see what happens over time. But I suspect as a class, that would be my opinion, not that I can base in hard scientific fact, but I can base in hard scientific fact that the studies have shown that tirzepatide in these patients resulted in dramatic improvement and allowed many of these patients to not have to use CPAP or these other devices. And so, they could then get back to exactly as they grew up in terms of dealing with this problem. And, I think this is really a big deal, Terry. People forget their CPAP mask. They sometimes get infected. There are other things that happen. Even if you have a mouthpiece, you can forget it at times. But if you've basically gotten rid of the underlying cause of the problem, then that's probably always the best medicine that we have. And so, historically, these medicines have been fairly expensive, but when covered by insurance, it makes them obviously far more affordable. And I suspect with time, as more and more of these are used, the medicines themselves will become cheaper as well. But the fact that in the past, the only real indication that you could use these for that was FDA approved and that insurance would cover was the treatment of diabetes. And they're certainly very effective there. Interestingly, and very interestingly to me, non-diabetics can use this too, and it does not seem to lower their blood sugar. It seems to just keep it normal at that point. And in diabetics, what we've seen is these agents, the GLP-1 agents, seem to more stabilize blood pressure. They bring it to near that normal control where we want it. They don't have the high highs and the low lows. And, that's associated in and of itself with positive effects. So patients, as I've just mentioned, with sleep apnea are more likely to have heart attacks, more likely to have heart failure, more likely to have atrial fibrillation, more likely to have these other issues. And one of the things that the GLP-1s, particularly semaglutide, which has been around longer and has more data thus far, but I suspect some of this is also a class effect, have been shown to help lower cholesterol. They've been shown to decrease heart attacks. They've been shown, to decrease all sorts of things. Kidney failure now is starting to come out. And so in a patient who's higher risk, who's obese, who's had sleep apnea, who's developed atrial fib, who may have had a stroke or other things associated with these things, I think this can be a transformative therapy where instead of controlling a symptom, we actually cure the cause. And always in medicine, getting down to the cause and dealing with that is best. I have said, and I've preached since the first day I've become a doctor, that prevention is our best medicine. I'm a doctor that sent end-stage peripheral artery disease, venous disease, other things, and I treat it. And many of these patients have really, limb-saving and life-changing outcomes. But that's not the best therapy. The best therapy is for us to prevent disease. And if we're going to ever focus our society on something that's going to really move the needle and really drop costs and really improve our health, we have to become more proactive. We have to interact with disease at the basic cause. And we have to do that as early as possible. Because once a disease is there and it's affected the end organs, you're really digging out of a hole. It's not the same as preventing the disease. Terry, you've used these agents in the past, and you've had a very positive effect, have you not, in terms of how you felt, in terms of your energy level, et cetera?
Yes, Dr. Walker. GLP treatment for me has been amazing. I didn't go in for sleep apnea. I went in for obesity. And but I will say I'm pretty certain, along with the my weight problem I had, it did also cause some I probably had, as well had sleep apnea, and probably was dealing with some chronic fatigue because of that. And I've lost, I want to say, 111 pounds, which sounds like a lot of weight, but I'm a big guy, but I've never felt better, and I sleep great. And other than having to get up a few times here and there to go to the restroom, depending on how much water I've drank before bedtime, but the sleep is not a problem, and I'm thrilled that that something that really so easy to incorporate into your life can, like you said, instead of you're treating the symptoms, you're going upstream and getting to the root cause.
So it's so important, Terry. And, I think that I don't think people have an idea of really how common sleep apnea is. This is a disease that's missed left and right. And many people believe, well, it's just the snoring. That is, there are many people who think, well, I don't care if I snore or not. I don't care if they snore a lot. That's not why I'm interested in the disease process, but I do care if they develop atrial fibrillation and have a stroke because they throw a clot. I do care if they go on to having heart failure. I do care if we cannot control their blood pressure. I do care for all of these other things associated with it. So, one message I would have to people out there, if someone is overweight in particular, but even if they're not, if they snore, they should be checked for sleep apnea. In today's world, it's not an expensive test to check. It's not obtrusive. You go home and it's wear something that really looks kind of like an iWatch, that everyone wears. It's not some big heavy device that fits over your mouth or anything. What it's looking for is episodes of hypoxemia or low blood oxygen at night. And that can tell you whether or not you have sleep apnea. And if you do, then there are just these measures that I've mentioned, and correcting those measures, correcting the sleep apnea is crucial. And not everybody needs weight loss, particularly if you're thin in the first place, and thin people can have it. But certainly a mouthpiece or other things can really affect this and stop the progression of disease. And once again, as I've mentioned before, if we allow someone to keep having episodes of atrial fibrillation, to keep having bouts of heart failure, to do these, there is damage that occurs with each of those episodes that we should avoid. And so just in terms of keeping ourselves healthy and keeping those we love healthy, making sure that we diagnose obstructive sleep apnea in particular, but central sleep apnea, of course, as well, which really carries substantial risk, is, I think, imperative. And I think it's one of those diseases that we put on the back burner that really needs to be on the front burner. It's something that people have to pay attention to, look for, and no longer do we just think of snoring as being something that's aggravating or loud or, in that manner. Realize that is usually, not just often, usually a sign of something underlying that's much more important that should be addressed.
That is really amazing. And the fact, again, these GLP-1s, I mean, there's so many things that are being explored, whether it's drug addiction, smoking cessation. I mean, they're just looking at all the aspects that these can impact. And what's really exciting about this class of, I guess, call it a medication, is that they're safe. They don't, other than maybe making you constipated or having diarrhea or something, if you take too much or too little, or, if you don't have your dosage correctly, there's really not a lot to deal with other than, when you were telling me about the first time, I said, well, Dr. Walker, I think I've heard there's a few side effects, and said, yeah, there's one big one. You're going to live long.
That's
So
right.
I'm quite the advocate for it, for what it's done for me in my life. And like I said, I sleep so much better now. And I think some of that is, the weight creates issues with your sleep.
Terry, I'll tell you, these drugs, we didn't even talk about it here, but their impact on how we're controlling diabetes itself, of course, is something that we can do a whole session on one point, and I can go into the science behind that. But, historically, drugs we've used to control diabetes bring down our glucose in a different way. And so often patients have high highs and low lows. This, by affecting the way our body absorbs the nutrients and sugars and the things that we have, and by slowing gastric motility, tends to really normalize blood sugar around a more normal range. You avoid the peaks one way or the other. The episodes where you have to suddenly take something with sugar, to treat your hypo or low blood sugar, hypoglycemia, and where you're having to treat profoundly elevated blood sugars. And, for diabetics, in my opinion, these drugs have been a godsend because of their cardiovascular effects as well. And, there's an awful lot of progress being made along these lines. There are new GLP-1s being evaluated in trials. And certainly I'm excited to see that these do, along with another class of diabetic drugs, the SGLT2 inhibitors, that in essence, what these drugs do is they block the reabsorption of glucose in the kidneys. They do so at the proximal convoluted tubule of the kidney, and we excrete some of that blood sugar in our urine. But these drugs have been shown to protect kidneys against diabetic kidney failure over time. So, some of these diabetic medicines designed purely for diabetes are proving to be cardiovascular drugs as well. And I think, kudos to the companies that have done these. I think these have represented giant milestones, improvement milestones for treating our patients who have diabetes, obesity, and these other problems. And make no mistake about it, diabetes is epidemic in the United States, and obesity is even more epidemic. And we're going to have to address these problems more effectively. And I think these medicines can help us with that.
Well, Dr. Walker, thank you so much for the details around treatment of sleep apnea with these GLP-1 medications, and updating us on the approval of tirzepatide for the treatment of sleep apnea. We will have more discussions about GLP-1s and the various effects they can have on patients' conditions as those become approved and available. And I'm looking forward to those discussions. Thank you so much, Dr. Walker.
Thank you.
Thanks for listening, and please subscribe, like, and share this podcast with your friends and family. Join us next week for new topics and answers with Dr. Craig Walker and Terry Roberts on Cardiovascular Matters.